When someone is unresponsive, is not breathing, or only gasping, and has no pulse, it is critical to begin CPR right away. CPR consists of 30 chest compressions, followed by 2 ventilations. Compressing the chest and allowing it to return to its normal position moves blood carrying oxygen to the brain and other vital organs. First, ensure that the person is on their back on a firm, flat surface, such as the ground. Next, kneel beside them like this with your knees near the person's body and spread about shoulder-width apart. Place the heel of one hand in the center of their chest with your other hand on top. Now, interlace your fingers and make sure they are up off the chest. Then, position your body so that your shoulders are directly over your hands. Lock your elbows to keep your arms straight. This technique allows you to use your body weight to help compress the chest. You are now in the correct position to give compressions. When giving compressions, push hard and fast. Compress the chest to a depth of at least 2 inches and a rate of between 100 and 120 compressions per minute, or about 1 every half second. After each compression, let the chest return to its normal position. Watch as I demonstrate just a few chest compressions so you can see what they look like. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Now it is time to put the skills you have just learned, giving chest compressions and giving ventilations, together in order to give cycles of CPR for an adult. Each CPR cycle consists of 30 chest compressions followed by 2 ventilations. Remember, it is important to begin each CPR cycle with chest compressions. However, if drowning is the suspected cause of cardiac arrest, deliver 2 initial ventilations before starting CPR cycles. Also, make sure you smoothly transition between chest compressions and ventilations. Interruptions in compressions to give ventilation should be as short as possible, taking less than 10 seconds. Okay, now watch as I put chest compressions and ventilations together to perform 2 cycles of CPR. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
CPR for a child is essentially the same as CPR for an adult, with 2 small differences. First, compress the child's chest to about 2 inches instead of to at least 2 inches. Second, when giving ventilations, open the airway to a slightly past neutral position instead of to a past neutral position. As for an adult, each CPR cycle for a child consists of 30 chest compressions followed by 2 ventilations. And just as you would for an adult, compress the chest at a rate of between 100 and 120 compressions per minute and allow for full chest recoil. For a small child, you may only need to perform chest compressions using 1 hand instead of 2. When using 1 hand, be sure you're able to compress the chest about 2 inches. Simply place the heel of 1 hand in the center of the chest and give compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. For a child or an adult, once you begin CPR, do not stop. Continue CPR until you see signs of ROSC, such as movement, breathing, or coughing. An AED is ready to analyze the heart rhythm. Other trained providers take over and relieve you from giving compressions and ventilations. you're too exhausted to continue, or the situation becomes unsafe.